Hi guys, so today is 26th September and annually it is celebrated as World Contraception Day. The theme for the World Contraception Day 2024 is a choice for all, freedom to for plan and power to choose, and also the empowering women and empowering the humanity. So in this PPT I'll talk about contraception. So, what is the outline of this PPT? So, the introduction to the World Contraceptive Day, family planning, contraceptive methods and classifications, temporary spacing methods, natural methods, barriers, IUCDs, non-hormonal contraceptives, hormonal contraceptives such as oral and parenteral, terminal methods, male sterilization, female sterilization, effectiveness of all contraceptive methods, and what are the government initiatives. So, first of all, introduction to World Contraception Day. So, the World Contraception Day aims to raise awareness about contraceptive options and the importance of informed choices. Every year, it promotes the right to access family planning resources, empowering the individuals to make the decision about their reproductive health. The prevention of conception is called as contraception. So, the contraception is useful to prevent the population explosion. It is also called as birth control methods or family planning methods. This can be done at the female, male, or coital stages. So, what is the contraception again? So, it is nothing but against conception. So, the preventive methods to help women avoid unwanted pregnancies are called contraceptive methods. So, what is family planning? So, all individuals and the couples have the right to decide freely and responsibility the number of spacing and timing of their children and to have the information, education and means to do so, and the right to attain the highest standards of sexual and reproductive health. So, what are the ideal contraceptives? So, the ideal contraceptives are those which are safe, effective, acceptable, reversible, inexpensive, and long lasting, and which requires little or no medical supervision. Okay, so contraceptive methods and their classification. So, there are two types of contraceptives. First is temporary or spacing method, and so alternative is terminal or permanent method. So, what are the temporary? So, it used for the spacing or giving a gap between children, used to postpone children's arrival while the couples gets adjusted. This includes natural methods, barriers, IUCDs, non-hormonal contraceptions, hormonal contraceptions, oral and parenteral, emergency contraceptions. In the terminal, there is a permanent stopping of conception used by couples who have finished their family. So, female sterilization or tubectomy and male sterilization or vasectomy can be done. So first is natural methods. So it includes four types, which is first is abstinence, the best. Then second is rhythm method. Third is coitus interruptus. D is lactational amenorrhea method, LAMM. So first we'll talk abstinence, which is the best. It aims at avoiding the sexual intercourse. Mechanism exclude the sperm from female reproductive tract. Effectiveness is 100%. Which is 0% failure rate. Ideal for adolescents at high risk of pregnancy and STDs including HIV. So the advantages are no side effect, no cost implied, natural menstruation not affected, culturally and morally accepted. But what are the disadvantages? It needs commitment, motivation, training, and cooperation of both the partners, may be difficult to abstain, peer pressure, may not be prepared with a backup method if they choose to become sexually active. Then second is rhythm method. So this method is based on identification of a fertile period of a cycle to abstain from sexual intercourse during the period. The method to determine the approximate time of ovulation and the fertile period include three parts. Calendar rhythm can be used, then temperature rhythm can be used, or mucus rhythm can be used. So what are the advantages of rhythm method? No cost, then lack side effect. The failure rate is 20 to 30 HWY. What are the disadvantages? So the disadvantages are difficult to calculate the safe period reliably, needs several months training to use these methods, then compulsory abstinence from the sexual act during certain periods, not applicable during lactational amenorrhea or when the periods are irregular. So, first, calendar rhythm, also called as safe period method. During the fertile period, coitus is avoided. The rest of the cycle is safe. So, the effective in regular cycle efficacy reduces even one cycle is out of 26 to 32 day range. Based on the assumption that in a woman with a regular cycle, ovulation takes place on 14 plus minus 2 days before the onset of the next period, and that the ovum if not fertilized, seldom survival more than 48 to 72 hours. So the fertile period. Beginning by subtracting the 18 days from the length of the shortest cycle, end by subtracting 11 days from the length of the longest cycle. So women with the cycles ranging from 26 to 30 days, periodic abstinence practiced from 8 to 19th day. For example, find the first fertile day. If your shortest cycle is 26 days, subtract 18 days from 26 minus you will get 8. Then count 8 days starting from first day of your period. If day 1 was the 4th of the month, you will mark as X on the 11th. So 11th is your first fertile day on of this cycle. You should stop having vaginal sex on this day or start using another method of contraception. So in this chart you can see. So if you find the last fertile day, if your longest cycle is 30th day, subtract the 11th from the 13th minus, you will get 19. Then count the 19 days starting from day 1. If day 1 was 4th of the month, you will mark X on the 22nd. So the 22nd is your last fertile day of this cycle. You can start having unprotected sex and next day. So the unsafe period is 11 to 22nd day of this month. So you can use different apps like calendar, flow to put your periods or menstruation cycle date in this app. So rhythm method, you can see menstruation occurs for approx 1 to 5 days. Then after that safe period, then there is a fertile days from 11 to 16, but it can be up to 19 also. Then others are safe days. So next is temperature rhythm. So what is temperature rhythm? It is noting the basal body temperature chart. Woman takes her basal body temperature at the same time every morning before she gets out of the bed or eats anything. Temperature will rise slightly 0.2 to 0.5 degrees Celsius just after ovulation. Third, mucus rhythm or Billings method. So it includes noting the excessive mucoid vaginal discharge, cervical mucus changes at mid-cycle due to hormonal changes, particularly effect of estrogen on cervix, scant and thick pre-ovulatory cervical discharge changes to profuse, transparent, watery, slippery discharge which can be drawn or stretched out into a thread, which is called spin Barkett's test between the two fingers, designed as a pick day, and intercourse is avoided. Then third is coitus interruptus. What is this? It is a withdrawal method. So it is historically the oldest in humans. Man withdraws his penis from the partner's vagina and ejaculate outside the vagina, keeping his semen away from her external genitalia. Widely used but have obvious disadvantages. So what are the advantages? No appliances is required, no cost, and failure rate is 20 HWI. What are the disadvantages? So it requires sufficient self-control by the man, and the woman may develop anxiety, neurosis, vaginismus, or pelvic congestion. Chances of pregnancy is more, such as precoital secretions may contain sperms. Accidental chance of sperms deposition into the vagina can occur. So the lactational amenorrhea method, LAM. So these include natural effects of breastfeeding or fertility. So the mechanism is suckling causes increased prolactin, which inhibits the estrogen production and ovulation. So 2% typical use failure rate in first 6 months. So candidates such as amenorrheic women less than 6 months postpartum who exclusively breastfeed 90% of nutrition in breast milk, women free of bloodborne infections, women not on drugs that could affect the baby. LAMA complications. Breastfeeding may increase the risk of mastitis, return of fertility, or ovulation may precede menses. 33 to 45% ovulate during the first 3 months. Encourage backup form of contraception. The failure rate for the LMA is 2%. Then second is barrier methods. So there are two types, physical barriers and chemical barriers. So the physical barriers are such as in male condoms, in female there are condoms, diaphragms, cervical cap, vaginal sponge. So the chemical barriers, which includes spermicidal, it can come in the form of foams, creams, suppositories. So the male condoms, most commonly known and used contraceptives, better known in India as a Nirod, sheets of latex, polyurethane or natural membranes that may or may not have a spermicides. Mechanism of these are barriers that prevent the sperm and infection from entering the vagina. Effectiveness is almost 15%, typical use failure rate. So the candidates, couple not in mutual monogamous relationship, couple in which one partner has an STD or HIV, couple starting other type of birth control, couples who can't use hormonal methods. So the failure rate of the male condoms is 15 HWY. So the HWY is 100 women per year. So the advantages and disadvantages of condom. Advantages are cheaper with no contraindication, no side effects, easy to carry, simple to use and disposable, protection against sexually transmitted diseases, example gonorrhea, chlamydia, HPV and HIV, protection against pelvic inflammatory diseases, reduces the incidence of tubal infertility and ectopic pregnancies. Then protection against cervical cell abnormalities, useful where the coital act is infrequent and irregular. So what are the disadvantages of male condom? First is may accidentally break or slip off during coitus, inadequate sexual pleasure, allergic reaction to the latex, to discard after one coital act, and failure rate is 15 HWY. So next is female condom. Female condoms are disposable, single-use polyurethane sheet placed in the vagina. These are flexible, movable, inner ring at closed end used to insert into vagina. Flexible outer ring to cover part of introitus. So the mechanism of the female condom is to prevent the passage of sperm and infection into the vagina. Failure rate is high at 21% with a typical use. So the female condom is reusable only if the partner does not have an STD. So the disadvantages are, these are awkward and difficult to place. So these are the female condoms. You can see the insertion, closed end we can put inside and open end is hang outside. Then condoms and spermicides. So you can see the images of the male condom. Then this is female condom. These are for spermicidal foam, creams, gel films and suppositories used for sponge. So the next, this is the diaphragm plus spermicide. So a diaphragm is a flexible latex dome-shaped cup. It is designed to fit securely in the vagina to cover the cervix. So you can see this diaphragm blocks the sperm from entering the cervix, and spermicides can kill inside the diaphragm. So the failure rate is 16 HWY. So the vaginal sponge plus spermicides. A foam sponge is inserted into the vagina to prevent the pregnancy. So the sponge absorbs sperms, preventing them from entering the vagina, and then spermicide kills the diaphragm. Spermicides inside the diaphragm kills the sperms. So you can see the sponge can absorb the sperm, and in this diaphragm blocks the sperm. So this is the difference. Then spermicide. These are the surface active agent which attach themselves to spermatozoa and kill them. Available in various forms like creams, films, foams, gel, suppositories, sponges, and tablets. So the most common is nonoxynol 9, best when used with a barrier method. Failure rate is 29% when used alone. Provides no protection against STDs and HIVs. So the failure rate of spermicide used when used alone is 29%. Intrauterine contraceptive device, IUCDs. So there are three generations of IUCDs. So the first generation is inert or non-medicated devices. Example, Lippy's loop, left as long as required. Then second generation is metallic IUDs, which also includes copper T380A. Its lifespan is 10 years. Nova T can be used up to 5 years. Then multi-load devices. Then the third generation, these are hormonal IUDs, Progestasert, 2 years we can use. Then Mirena, LNG20, we can use up to 10 years. So you can see this is Lippy's loop, and these are the first one is the Progestasert, stem and reservoir we can see. Then this is copper 380, copper T, and this is placement. While placing, we can see the copper T inside an insertion tube. So what is the mechanism of action of copper IUDs? This prevents the fertilization by impairing the viability of the sperm, interfering with the sperm movement. So the IUDs, we can see copper IUDs, Paragard 380A or Mirena, levonorgestrel. So first of all, the copper is a spermicide that inhibits the sperm motility and acrosomal enzyme action, lasts 10 to 12 years, may increase the bleeding and dysmenorrhea. So the typical use failure rate is 0.8%. Mirena, levonorgestrel, increases the thickness of cervical mucus to inhibit the sperm migration, lasts up to 7 years, improves the menorrhagia by 90% in most patients, causes amenorrhea in many users. Typical use failure rate is 0.1%. So IUDs, good for women in mutually monogamous relationships. Time of insertion at the time of menstruation, 2 or 3 days, then post-abortal, immediate following the MTP, then postpartum, immediately after delivery of the placenta or up to the 48 hours. Post-puerperal is 6 weeks after the delivery. Then what are the complications? So first is immediate. Immediate complications are cramp-like pain, fainting with insertion or syncopal attacks, partial or complete perforation. Then remote pain, abnormal menstrual bleeding, PID, which is pelvic inflammatory disease, and spontaneous expulsion. So IUDs are safe, effective, convenient, reversible, long-lasting, cost-effective, and easy to use. So what are the contraindications for insertion of the IUCDs? These are presence of pelvic infection, genital tract bleeding, uterine fibroid, severe dysmenorrhea, history of ectopic pregnancy, cesarean section, and copper allergen. So what are the advantages and disadvantages again? So we can see advantages. These are inexpensive. Copper T distributed free of cost through the government channel, and simplicity in techniques of insertion and most cost effective of all methods. Prolonged contraceptive protection against insertion such as 5 to 10 years and suitable for the rural population of developing countries. There are systemic side effects are nil. Suitable for hypertensive breastfeeding women and epileptics. Reversibly to fertility is prompt after removal. And what are the disadvantages? So the disadvantages, it requires motivation, limitation in its use, adverse local reaction manifested by the menstrual abnormalities such as PID, pelvic pain, heavy periods. Besides, effects are less with the third generation IUDs. Risk of ectopic pregnancies. So what is the failure rate? It is 0.1 to 2 HWY. The next is oral contraceptives, also called oral pills or oral contraceptives, OC pills, are usually hormones or combinations taken by mouth. Types of oral contraceptives are: first is non-hormonal pill, second is hormonal pills. So, non-hormonal contraception or non-steroidal contraception. Active ingredients are centromine or also known as ormeloxifene. So centromine or ormeloxifene is a non-steroidal, non-hormonal once a week oral contraceptive pill. It acts as a selective estrogen receptor modulator SERM. In some tissues or organs of the body, it has a weak estrogenic action, example bones, while in others it has a strong anti-estrogenic action. Example uterus, breast, etc. Example Saheli and Chaya. Mechanism: prevention of the uterus from preparing for blastocyst implantation, which is required for pregnancy. Chaya is supplied free of cost through the government health centers and hospitals. So you can see centromine or ormeloxifene is a safe and effective. Centromine is ormeloxifene is safe for the breastfeeding woman. Apart from the prolongation of the menstruation cycle, in some women it is not known to cause any side effect. One pill is taken twice a week for first 3 months, followed by once a week thereafter. So next is hormonal contraception or steroidal contraception. So the oral and parenteral. So the oral is combined PrEP, monophasic, biphasic, triphasic, emergency, single PrEP, progestin only pill, estrogen. So the parenteral are injectable, DMPA, NET, combined. Implants are eplenolone or Norplant, then LNG rods. Hormonal contraception or the steroidal contraception. These are combined oral contraceptives, contain both an estrogen, usually ethinyl estradiol, and progestin, Mala N, Mala D, 0.15 mg levonorgestrel, and 0.03 mg ethinyl estradiol. Then second is progestin only contraceptive, which contains only progesterone, a synthetic analog of progestin. Then third is postcoital contraception, which are the emergency contraception, which include levonorgestrel, ulipristal, and mifepristone. Then combined oral contraceptives, estrogen and progestin. So what is the mechanism? It blocks the ovulation, thickens the cervical mucus, thins the endometrial lining to discourage implantation. What are the types? Ethinyl estradiol is the most commonly used estrogen in OCPs. There are multiple forms of progestin. Monophasic, same amount of hormone in each active tablet. Multiphasic, varying amount of hormones in each active pill. The available COCs pills in the public sector is Mala N. It contains the levonorgestrel 0.15 mg plus ethinyl estradiol 30 micrograms. It is supplied free of cost through the government health centers and hospitals. Each strip of Mala N contains 21 hormonal tablet and 7 non-hormonal iron tablets. So COPCs, combined oral contraceptive pills or non-contraceptive. What are the non-contraceptive uses of the OCPs? So they can also be used in dysfunctional uterine bleeding, dysmenorrhea, endometrial and ovarian cancer, iron deficiency anemia, endometriosis, PCOD, acne and hirsutism, functional ovarian cyst. So when to start OCPs? So if you woman's situation and when to start. So having a menstrual cycle, then any time within the 5 days after the start of her monthly bleeding, no need for the backup method. Any time after 5 days of start of her monthly bleeding, if it is reasonably certain that she is not pregnant, a backup method, example condom, is needed for the first 7 days of taking pills. If the pregnancy cannot be ascertained, give her COCs now and tell her to start taking them during the next monthly bleeding and use condoms till then. Breastfeeding. Less than 6 months after giving birth, then not recommended in less than 6 months after giving birth. Prescribe the alternative methods like PCOS, progesterone only pills, centromine or meloxifene, and injectable contraceptives. If more than 6 months after giving the birth, then any time if her monthly bleeding has not returned and if it is reasonably certain that she is not pregnant, a backup method, example condom, is needed for the first 7 days of taking pills. If the pregnancy cannot be ascertained, give her COCs now and tell her to start taking them during her next monthly bleeding and use a condom till then. If her monthly bleeding has returned, COCs can be started as advised for women having menstrual cycle. So how to use COCs pills? One pill should be taken every day even if there is no intercourse until the pack is empty. So the 28 pill pack. When she finishes one pack, first pill from the next pack should be taken on the very next day. Bleeding occurs when the woman is on the tablets given in the last row of the pack, iron tablets. However, pills should be continued irrespective of the bleeding. It is very important to start the next pack on time. There is a risk of pregnancy if the pack is started late. If she vomits within the 2 hours of taking pill, another pill from the pack should be taken as soon as possible and rest of the pills should be continued as scheduled. So how to manage missed pills? Missed pills and how to manage. If missed 1 or 2 pills or started new pack 1 or 2 days late, then take one hormonal pill as soon as possible or 2 pills at a scheduled time. There is a little or no risk of pregnancy. If missed 3 or more pills in the first or second week or started new pack 3 or more days late, take one hormonal pill as soon as possible and continue the scheduled pill. Use a backup method for next 7 days. Also can consider taking ECPs if she had sex in the past 72 hours. ECPs are emergency contraceptive pills. If miss 3 or more pills in the third week, then take one hormonal pill as soon as possible and finish all hormonal pills in pack as scheduled. Throw away the 7 non-hormonal pills in the 28 pill pack. Start a new pack the next day. What are the advantages and disadvantages of combined oral contraceptive pills? So the advantages are highly effective, good cycle control, well tolerated in majority. Additional non-contraceptives benefits are many. So low dose pill and lipid friendly progestins further reduces the risk such as cardiovascular diseases risk. Then reversibility rate is prompt and also some cancerous risk. Then disadvantages, it requires education and motivation, limitation in its use, then requires initial checkup and periodic supervision, inconvenience caused in its use due to the daily schedule, risk of drug interaction can occur, then costly but free supply through the government channel are Mala N. The failure rate is 0.1 HWY. So the next is progestin only contraceptive. So it contains low dose of synthetic hormone known as progestin, which is like a natural hormone of progesterone in women's body. So the progestin only pills are also called as mini pills. The available products is levonorgestrel, LNG, and desogestrel. When to start? Any day within the 5 days of the menstrual cycle if no need for the backup method. Anytime after 5 days of menstrual cycle, if it is reasonably certain that she is not pregnant, a backup method, example condom, is needed for the first 2 days of taking pills. How to use progesterone only pills? All the pills in the progesterone only pill packs are the same color and are active pills containing a hormone that prevents the pregnancy. One pill should be taken every day at the time until the pack is empty. Delayed intake of the pill may increase the failure or the risk of the pregnancy. It is very important to start the new pack on the next day at the same time as starting a pack late risks the pregnancy. Example Serele, Noride, Cerazette, Norgeston, Lovima and Hannah. Then third is postcoital contraception, also called as emergency contraception. These are used to prevent the pregnancy after unprotected sexual intercourse or contraceptive accident like condom rupture or missed pills. In the national program, emergency contraception pill contains only progestin, levonorgestrel 1.5 mg per tablet, also called as morning after pills or postcoital contraceptives, common in women after assault or rape. If the patient does not have a cycle of 21 days, it is important to check a pregnancy test. Then emergency contraceptive pills in the public sector is Easy Pill. It is supplied free of cost through the government health centers and hospitals. Other examples are iPill, Unwanted 72, Plan B1 pill, Take Actions, Ella1. So, what are again emergency contraception? It includes three types. First is high dose progestin only. Plan B. These are 1.5 mg norgestrol at one time or even in divided doses. Divided doses are first dose within 72 to 120 hours of intercourse, second dose 12 hours later. Then one dose both tablets within the 72 to 120 hours of intercourse. Then there is this USP method prevent, which is 100 microgram of ethinyl estradiol and 0.50 mg of levonorgestrel in each dose. First dose within the 72 hours of intercourse and second dose 12 hours later. Then there is a copper iodide placed within the 5 days of unprotected coitus. This is usually given to women who plan to use the IUD for long-term birth control, interferes with the implantation after fertilization. Then there is a parenteral contraceptives. These are long-acting reversible hormonal contraceptives that are administered by the injection or implant. So what are the types? There are injectable and implants. In injectable, there is a DMPA, dipot medroxyprogesterone acetate, then NET or EN, norethindrone enanthate. Then there is a implants. It is a small, flexible plastic rod that is inserted under the skin. It's just like a mastic. Then under the skin and upper arm prevents the pregnancy. It works by releasing a hormone called progestogen, which prevents the ovaries from releasing an egg each month. Examples: Implanon, Norplan, LNG rods. Then there is an injectable DMPA, Depo-Provera. These are it's a progestin only injection. 150 mg IM every 3 months can be given. Contraceptive level maintained for the 14 weeks. Failure rate is 3%, typically used failure rate. Mechanism is thickens the cervical mucus, blocks the LH surge, initiate the treatment during the first week of menses. Advantages are long-acting, estrogen-free, safe in breastfeeding, can be used in sickle cell disease and seizures disorder. Patient does not have to take daily, increases the milk quality and nursing in nursing mothers. What are the disadvantages? The irregular bleeding, 70% in first year, then breast tenderness, weight gain, depression can occur, slow return of menses after stopping use, then decreases HDL cholesterol, high density cholesterol, it decreases. Then Antara DMPA contraceptive. So DMPA contraceptive in India is also known as Antara. It is a reversible contraception method. The injection has to be taken every 3 months. Any woman of 15 to 45 years of age can use this if it is available free of cost in government health center and hospitals. Then there is a transdermal patch or birth control patch. It is a small, sticky patch that releases the hormone to prevent the pregnancy, delivers the 20 microgram of ethinyl estradiol and 150 microgram of norgestromine daily. Patch is replaced once per week for 3 consecutive weeks, worn on abdomen, buttocks, upper outer arm or upper torso. Do not place on breast. Then advantages are only has to be replaced once per week, may be taken continuously. Disadvantages may slip off, provide patient with an emergency patch. Patch may be less effective in women who are overweight. Then there is a terminal methods of contraception, permanent methods, one-time method, also called as sterilization. Sterilization refers to the surgical procedure intended to render the person infertile. Most procedures involve the occlusion of the passageways or passage for ovum and sperms. Guidelines: husband's age 25 to 50 years, wife's age 20 to 45 years, two living children at the time of operation. Then types are: for males, we can use vasectomy, non-scalpel vasectomy; for females, tubectomy, mini lap operation, laparoscopic sterilization, or tubal ligation. So, terminal methods in man, which is vasectomy, comparatively simple, simple outpatient procedure done under the local anesthesia. A small incision is made in the scrotal skin like this, and the pieces of the vas difference at least 1 centimeter is isolated and cut, and the two ends are ligated and folded back on themselves. So, non-scalpel vasectomy (NSV), it is a minimally invasive procedure that involves making a small puncture in the scrotum to access the vas deferens, the tube that carries the sperm from the testicle. The procedure is different from conventional vasectomy, which uses a scalpel to make an incision, instead a sharp instrument to puncture the skin. Failure rate is 0.15%. The non-scalpel vasectomy (NSV), advantages and disadvantages. So advantages are: no incision, no stitch, no admission, outpatient procedure, minimally invasive, requires only 3 instruments, less chances of complications than the tubectomy, safe, convenient, and acceptable method, cheaper than tubectomy, requires no daily attention or follow-up, does not affect pleasure. So what are the disadvantages? Not immediately effective, not protect against STDs, use a contraception until the completely azoospermia for the 2 consecutive sperm count, usually takes 12 weeks or 10 to 20 ejaculations. Then what are the terminal methods for the females? These are female sterilization. So the time of operation, immediate after birth within 24 to 48 hours, at the time of abortion, and interval procedure during the proliferative phase of menstrual cycle. So the first is tubectomy. Part of the fallopian tube is removed and the two ends are tightly ligated, and it is conventional method. So you can see this can be cauterized, tied and cut and banded. There are different types. So then second is laparoscopic tubal ligation. So done through the abdominal approach with a specialized instrument called laparoscope. The abdomen is inflated with the gas. Then instrument is introduced into the abdominal cavity to visualize the tubes. Once the tubes are accessible, the fallope ring are applied to occlude the tubes. Then there is a postpartum tubal ligation. Postpartum tubal ligation is one of the most effective female sterilization techniques. Failure rate is 0.05 pregnancies per 100 women years. Then laparoscopic tubal ligation. What are the advantages and what are the disadvantages? So the advantages are: advanced method of sterilization. It is simple or small incision, easy to perform, done in short time. Hospitalization is limited. Scar will not be visible. Disadvantages: the instrument is expensive, costly compared to the other methods, requires adequate maintenance, requires sufficient training to use the instrument. Then terminal methods, which includes mini lap operation, much simpler procedure, requires a smaller abdominal incision and only 2.5 to 3 cm to reach the fallopian tubes. It conducted under the local anesthesia. It involves the tubal ligation through the cutting of the fallopian tubes or to application of the band or clip. The failure rate is 0.7%. Then effectiveness of all contraceptive methods. So we can start from less effective to more effective. So spermicides are less effective. Then there is female condoms, standard days method. Then male condoms, progesterone only injections. Then intrauterine device. Then female sterilization. Then male sterilization. Then implants and male sterilization are more effective. Then, what are the initiatives by the Indian government? There are dual-step delivery of contraceptives, intensives for the ASHA and people for the spacing the pregnancies, incentives for ASHA and people for the permanent sterilization, awareness programs for the birth spacing and contraception are there. So all these family planning methods are such as IUCDs, OCPs, condoms, emergency contraceptive pills. These all are the service providers are ASHA workers, ANMs, and some doctors. In mini lab, laparoscopic sterilization, and NSV, no scalpel vasectomy, the trained and certified MBBS doctors and specialist doctors can be service provider. Then benefits of contraception. It reduces the maternal and infant mortality and increase the education and economic opportunities, improve the family planning and spacing. It reduces the risk of sexually transmitted infections such as STIs, enhances the reproductive health. So on this World Contraception Day, let's work together to empower the individuals, especially women, to make the informed choices about their reproductive health. Thank you.